Thank you very much, Presiding Officer. First of all, I'd like to remind the Chamber that I am a board member of the Addiction Recovery Service moving on Inverclyde. Presiding Officer, this joint debate by three committees of this Parliament provides an example of the type of joined-up working that is required, and I agree with the comments from Elena Witham earlier when she stated that every committee in this Parliament has a role to play. This debate is of particular importance to me due to the sobering figures I read when the drugs death figures are published each year. Inverclyde, per head of population, is normally one of the areas with the highest number of drugs-related deaths. 33 constituents died in 2020, 28 men and 5 women. And of these people who died, 63% of those who died were in the 35 to 54 age category. That's my age group. Last night, I was reminded of how my age group can be caught up in drugs misuse. After a meeting I attended, I was informed of a school friend who sadly has been involved with heroin for some time. Growing up in Port Glasgow with declining traditional employment opportunities, it will certainly be part of the reason as to why some people became involved in drugs. And it's something that I've spoken about in this chamber before. And this is where the issue of deprivation, touched upon earlier by speakers and also by Michael Mara's intervention earlier, is relevant. The report published by Glasgow University and the Glasgow Centre for Population Health today suggests that people are dying younger as a result of UK government austerity certainly will not help the situation we as a society face. With regards to drug-related deaths, the report states, and I quote, "There is evidence of the effects of UK government austerity measures. Their impact is seen as twofold, reducing levels of important services such as addictions, housing, mental health, welfare rights and so on, and cutting individual incomes by reductions in social security payments, leading to further drug use as a coping mechanism." There are many areas of society that we all can and must do more to improve, but we can't do anything once someone has passed. They leave behind parents, children, friends who have to live with that loss forever. We must and can do more, and that's why when the First Minister announced in January 2021 the national mission to reduce drugs-related deaths and harms, supported by the £250 million funding over this parliamentary session, I welcomed that. I welcomed that funding to go towards improving and increasing services for people affected by drug addiction. The aim of the national mission is to save and improve lives through, first of all, fast and appropriate access to treatment and support through all services, and improve frontline drugs services, including the third sector. And that's something I've touched upon and others have touched upon in the chamber before. Last week, I met with the head of the Inverclyde Alcohol and Drugs Recovery Service. The local ADRS has had a change of strategy in recent years by bringing together the alcohol team and also the drugs team. Previously, they had operated independently. In a paper to the Inverclyde Integrated Joint Board in March 2020, the following was highlighted, and I quote, "The review of alcohol and drugs service provision within Inverclyde is nearing completion, with an aim to develop a cohesive and fully integrated whole-system approach for service users affected by alcohol and drug issues. Inverclyde historically has not had a well-developed recovery community. Therefore, developing more robust recovery opportunities has been identified as an area of required focus and attention. Work has commenced with a recovery strategy being developed." Now, I welcome the changes that have happened locally, and I know that there is a more cohesive and partnership approach taking place that just really hasn't happened before. Across the chamber, everyone will agree that we need to listen more to the needs and experiences of those who have lived with an addiction and also their family and friends. And too often, those with an addiction also suffer from mental health issues, which would cause issues with housing, finances, and put pressures on family dynamics. Now, this can then lead to a person's life being difficult to manage, and they fall away from treatment services. And the Scottish Government highlighted a need to address the high did-not-attend rates. As we know, a high proportion of people who died from drug-related causes never had contact with their drug treatment service. And to help this aim, the Scottish Government is providing £3 million per year to local services through alcohol and drug partnerships to increase outreach to people who need that support. The Scottish Government is also increasing the capacity of statutory funded residential rehabilitation places by 300% by the end of 2026, when at least 1,000 people will be publicly funded for their placement. Presiding Officer, safe drug consumption rooms and naloxone have been spoken about already. And the naloxone rollout programme is something that I welcome, and and I bought into it at the very outset. The establishment of safe drug consumption rooms, on the other hand, it took me longer to accept. The marketing campaign to raise awareness of naloxone and the signs of overdose, I'm sure, will prove to be very beneficial in the long term. But on the issue of the safe drug consumption rooms, it took me a lot longer, as I said. But the fact is, they work, they save lives. And if across this chamber, if we actually do want to save lives, every single thing has got to be on the table for consideration. I want to say thank you to the Minister and the Scottish Government for the £400,000 investment to the Jericho Society in my constituency. Jericho Society runs 2 residential units in Greenock, 1 for men and also 1 for women. Jericho has also received £78,000 last year from the Scottish Government, which allowed them to increase staffing hours by 50 hours in the Women's House. There is no one-size-fits-all approach. And that's why I genuinely believe that having a debate, having actions across this Parliament, across society, is the only way that we can really make those achievements and save those lives that we need to do. Thank you.